Now, not enough is being done to make improvements in the mental health sector. That's despite a $1.9 billion cash injection, and that's the finding of a report looking into the state of our services in New Zealand. Here's what National's mental health spokesperson Matt Ducey had to say about the situation on Newshub Late last night.
The mental health services and groups that I visit say to me they've seen none of the money promised. They can't point to where the money has gone. And you'd say for $1.9 billion, why has it made no difference? And why is it still hard to access services? And I think Andrew Little needs to front up and explain to New Zealanders where that money has gone.
And well, here he is. To respond to this, Health Minister Andrew Little joins us this morning. Good morning, Minister. Thanks for joining us.
Good morning.
So where has that money gone that Matt Ducey is talking about? Why have mental health organisations on the front line not seen a cent of $1.9 billion?
Well, that is simply not correct. Matt Ducey and the National Party have a lot to answer for because of their 9 years of neglect of the mental health system. So of the $1.9 billion, about $800 million of it went to a variety of other government departments, corrections, education, MSD, to do a range of things in mental health areas for their area. For the Ministry of Health, the $1.1 billion that they've got, over a 4-year period, nearly $500 million is going into what we call the Access and Choice program. 2 years into that program, we've added 850 full-time equivalent roles or people to the front line of mental health. They are people in GP clinics, in community clinics, working in kaupapa Māori health services. No, well, you've asked the question, so you've got to get the answer because there is an answer here. It is simply not correct for people like Matt Ducey and others to say the money is going nowhere. It is going all over the place, and it is making a difference.
Is it correct to say that
850 people in the front line of mental health who weren't there 2 years ago? That is making a difference right now.
OK, but is it correct to say that $1.9 billion has been spent on it when actually you're saying $1.1 billion has been given to the Ministry of Health? In fact, as you say, there has been money given to programs to get people into housing and employment, which is including but not limited to people with mental health concerns. There's been at least $80 million spent on the abuse and care inquiry, which are all very relevant and important projects. But is it clear to people who are working in mental health that that is actually where this $1.9 billion is also going towards?
Yes, it is. And in fact, community organisations
well, then why not say it's 1.1?
Additional funding too. Well, because the total package was addressing mental health issues across New Zealand. And we know that it's not just in the community, not just people in the homes and stuff, but people in our prisons, people going through the education system, people going through oranga tamariki, they all getting additional funding for mental health care as well. So the total mental health package was that figure, $1.9 billion over 4 years. We are just over halfway through that period of time, so the full $1.9 billion hasn't been spent. But in terms of
it is
health
quite
services,
widespread. In terms of the acute services,
it is being spent.
Okay, in terms of the acute services, we've added 5 extra mental health beds. How much does one of those beds cost?
We're actually in the process of rebuilding facilities that have been run down for a long period of time. So,
yeah, $235 million has been set aside for that. But how much does an extra mental health bed cost in acute services?
I couldn't tell you what the bed cost, but we are adding to that now.
Isn't that one of the key things that this $1.9 billion should have gone towards?
Well, it is going towards it.
How come there's only 5 after 2 years?
We have a $235 million building program. We've got Hill Morton well underway at the moment. We've got a big project in Waikato, which is in the final design stage, $100 million there.
Okay, so these are new facilities in the design stage, but they're not acute beds that are dealing with specialist care. There's $1.9 billion is a lot of money.
Sorry, you're not listening to the answer I'm giving you. I'll say that again because you clearly didn't listen to that. So of the new facilities that are being built, we've got Hill Morton under construction at the moment. We've got the Waikato facility that is in the final design stage at the moment. both of those facilities, when they're completed, will mean additional beds to the system. There are other facilities that are being upgraded. They will mean additional beds too. So it does take a bit of time when you're building a new building to get that to completion stage, but that is happening. But one thing that this government hasn't done, that the previous government did, was completely and utterly neglect the mental health system. That's why we have put record sums of money in it. I think the Mental Health and Wellbeing Commission is justified in their criticism to say there's more workers needed in the specialist and acute parts of our mental health system, and that work is underway. But the priority that the report that we had in 2018 said was deal with those with mild to moderate mental health conditions. That's the big gap. That's what we gave priority to. And by working at that end of the mental health challenges that we've got, we actually prevent a lot of people getting to the acute and specialist stage anyway.
Okay.
That's why we gave that priority.
If you say that underfunding was an issue with the previous government and that you were having to play serious catch-up, why then promise new facilities and new beds in acute services when really you've only been able to deliver on 5 mental health beds so far and projects that are at a design stage 2 years on from the funding being announced?
Well, the last major mental health facility that was built was opened last year. It took 5 to 6 years from the agreement to build it to actually opening it up and admitting new patients. That is what it takes, because mental health facilities, like most health facilities, have design requirements. We've changed the design we have for our mental health facilities, so the environment is more therapeutic in a way that a lot of the current facilities aren't. Part of the reports that we're getting at the moment too is too many facilities are simply not fit for purpose in helping people recover from their mental health issues. So we need to make sure that the design is actually going to be useful to people, help them to recover, settle down, and they can be released back into the community.
Okay, so in June last year you did a review of the spending and you said at the time that you were frustrated with the speed of the spend then. Well, now we've had another review yesterday by the Mental Health and Wellbeing Commission, which is levelling the same criticism at the speed. So how many reviews does there have to be before we see some meaningful change and some actual beds that people can go and get care in?
People can get care in the beds at the moment. My criticism was specifically about the building program.
I don't think that people can get care in beds, not everybody. There are reports of patients sleeping on the floor in acute wards.
So to go back to the question that you asked, the criticism I made last year was the pace at the building program. And that is now on track and well underway. And I visited the Hill Morton construction site just a couple of weeks ago, and the Waikato project, which is the biggest mental health facility rebuild project that we're doing. I'm now satisfied that is on track, and we'll get that construction underway by the end of this year. So it does take time.
And just to go back to what you said there about people can get beds and specialist care, can they? Is that true?
Yeah, people argue. I think what the report said is the delay, that there are delays, and particularly if somebody goes to their GP, the GP refers them to a specialist. There are undue delays in that respect. That is because we, like the rest of the world, are suffering from the shortage of psychiatrists, of clinical psychologists. I mean, part of the range of announcements I was making yesterday was the work we're doing to get more people into mental health and addiction services. But we can't. If we want a new psychiatrist or a new clinical psychologist, that's 7 to 10 years to get them up to speed.
Are the delays good enough, though, Minister?
We recruit from where we can.
Are the delays good enough for people who are suffering from mental health?
Look, when you're suffering from mental health, you want care and attention as quickly as you can get it. What is not acceptable is to take 9 years to say there's nothing wrong with our mental health services, to underfund them and to run them down. It might take a while to get things back up to speed and up to the spec that we would like them to be. That does take a bit of time. But the money is there, the things are happening, and we are making great improvements in that front line of our mental health services.
Health Minister Andrew Little, appreciate you being with us this morning. Thanks for your time.
Hey, Minister, just before you go, in 2017, you guys said, let's do this. Yep. You said you would fix the broken mental health system. And there were families who had children who were suicidal, who couldn't get help. Can you just give us some acknowledgement this morning that you haven't quite lived up to the hype? Can you just say to those families, I'm sorry, I'm sorry. We could have done better in the last nearly 5 years.
Ryan. What I will say is we made, and I toured the country doing public meetings, not about mental health, but mental health came up in every single one of them. That is why when we took office at the end of 2017, the first thing we did, as we promised we would do, we'd get a review of the mental health services, do a stock take. We did that. It was, and we didn't say we're not taking years to do it. We wanted as quick as possible. In 2018, we had a report that said the priority has got to be services for those with mild to moderate mental health issues. Put them in primary care, put them in the GP clinics. In 2019, we got the money in the budget, and that's what we started doing. That's why we now have 850 new people who were not there 2 years ago doing those roles in primary care, working in Kaupapa Māori Health Services, Pacific Health Services, specific youth mental health services. Those are new people, new roles in those services, doing 17,000 sessions a month at the moment, I think was the last figure I saw in February, making a difference to people's lives. That stuff is happening. It wasn't there 2 years ago.